going to join us at the Women's Show and be one of the featured speakers there. But first, Dr. Michael Devlin joins us to talk a little bit about tummy tucks.
No,
Good to see you.
Nice to see you.
Yeah, we'll talk more about the Women's Show coming up. I know a lot of people are excited about that. But a lot of people may be excited, but maybe dreading swimsuit season. It's on the way, and you worry about the tummy.
Oh, I know. We get a lot of women who come in, and, you know, whether they've had babies and they've done a lot of working out and they can't get rid of that little separation that they have, a little bit of hanging over. People who've lost a lot of weight, those type of patients who have had a C-section in particular, and they get that little part that it just hangs over the top, and they can't, no matter how much diet and exercise, they just can't seem to get rid of it. So a tummy tuck is really a good option for them.
So many times mothers who have had babies, does it kind of fix that C-section?
It does,
area?
because we make that incision below the C-section scar, so we keep it low in case you want to wear a low-cut bathing suit. You're not going to see any of the incisions. And we go in and we tighten up your stomach muscles from the top all the way down to the bottom. Gives you that flat washboard stomach you're kind of looking for, and you can't do enough sit-ups to kind of get the results that we can get by tightening things up.
And you do like people who've tried to lose weight on their own and are in pretty good shape before they do this,
yeah,
right?
and actually we encourage them to get to what their ideal or their goal weight is. You know, if you need to lose more than 20 pounds, then you really should probably wait to get a tummy tuck. So if you think you're right at where you want to be, this would be a good time to do it.
Okay, let's look at some pictures, because we were looking at these upstairs and we were like, wow, is that the same person?
Believe it or not, it is actually the same person.
Okay.
You know, you go in and you tighten up those stomach muscles, you remove over the excess skin, and you can end up with results like this afterwards. And, you know, you're ready for bathing suit at this time.
Right.
You get a lot of women who say, oh, I'll never wear a bathing suit again. They come in and have this procedure. Next thing you know, they are just so excited. They can't wait to go pick out a new bathing suit.
Do they get into bikinis again
they
after
do.
many years?
A lot of them said, I'll never do it again. And next thing you know, springtime rolls around and they're in that bathing suit that they never thought they'd wear again.
You mentioned people who've had weight loss surgery, which is, you know, becoming very common, and there's that saggy skin.
Yeah,
Can this fix that?
I mean, the most common weight loss procedure right now would be the lap band. And so, you know, if your weight has been stable for about a year after a lap band procedure, you're going to have all of that hanging skin. You know, the fat's gone, but that skin is still there. And the only way to get rid of that is with surgery. But, you know, the procedure itself is very, very comfortable. We use a pain pump afterwards. It diffuses numbing medication, kind of like when you go to the dentist.
Right.
So for about 3 days after surgery, that numbing medicine is in there. You're up walking around. Most people, believe it or not, are taking Tylenol the day after surgery.
And
they're up walking around day of surgery.
Because, you know, if we are talking about moms, they're coming home to kids and babies. Can they lift and do those kinds of things?
They can lift after about the first 6 weeks. We kind of restrict what they do for the first 6 weeks. But most people say, you know, the C-section was so much more invasive and it hurt a lot more. The tummy tuck, we don't do that because we're not cutting the muscles like they do with the C-section. We're just tightening them up.
Okay. Let's kind of go through the procedures. Should they do anything to prepare for the surgery first?
Well, like I said, you want to be healthy. You want to stay off any blood thinning products like aspirin, that type of thing, Advils, any of that type of stuff for about 10 days before surgery. Ideally, you'd like to have your weight, you know, within 20 pounds of what you think your weight should be or what you want to be, those type of things.
Okay, and then how long is the surgery usually? How long does it last?
The surgery itself takes about anywhere from 2 to 3 hours to perform. It's outpatient surgery, so you get to go home the same day. You're up walking around. And in fact, we encourage you to get up walking around because that decreases chance for blood clots. So you're up walking around, you're comfortable, and you can get phenomenal results just pretty much overnight.
Okay, and are there scars left over?
There are scars left over, and it comes down below and it comes up, but we keep those so low that you can wear a low-rise bathing suit and not see the incisions. So that people are really excited about that.
What I've noticed by looking at the pictures, sometimes the belly button is a lot cuter.
It is often, yeah, and that's where the art of this comes is, you know, you can get a lot of ugly-looking belly buttons. If you look at some websites, belly buttons aren't good. We really take our time with our belly buttons because that's what shows afterwards. So you can get a really nice looking belly button afterwards.
That's wonderful. Now, can you combine this with other surgeries? Because some people say if I'm going under, I want to have a couple things taken care of.
The most common thing that we do with a tummy tuck is called the mommy makeover, and that's where we do a breast augmentation and or a lift in conjunction with the tummy tuck. And you put those two together, that is a body transformation.
That's a wow, isn't it?
That's a wow.
All right, let's talk a little bit about the Women's Show. You're going to be there both days. What are you going to be doing?
We're going to be at the Women's Show. I'm going to be one of the featured speakers on Saturday. I'm going to be talking about surgical and non-surgical facial rejuvenation. We're going to have a lot of different giveaways at our thing. Well, we're going to have a little contest, and we're going to be giving away Restylane, other things like that. So come by, check us out. We'll be there all weekend.
We're going to have fun. We're going to all be there. So there's the information. information about the Women's Show. It is Saturday and Sunday this weekend. There are the times for you at the Conway Expo Center. Of course, they're in Conway, so we're going to all be there having a good time. And then, of course, we want to remind you about Devlin Cosmetic Surgery on Executive Center Drive, and there's the information there if you need to call and you would really like to just have a consultation with someone first if they're interested, and that you can answer all their questions.
Yes,
right?
Absolutely. Our consultations are free. You can give us a call. We get you in. We'll kind of go over step by step. We spend a lot of time with you to let you know what your options are.
Yeah, so you're not nervous when you make that decision. All right, thank you so much.
Thank you.